You tested your blood sugar and your glucometer reading came out in mg/dl or mmol/L, and you thought you were looking for your A1c. So what is mg/dl and what is mmol/L? What is the difference between a glucose test and an A1c test, and how do you convert that reading over to A1c? Well, in this video, we're going to answer those questions for you. If you're a type 2 diabetic looking to reverse your condition naturally, then Type Rhino is the channel for you. Give us a subscribe, give us a like, press that notification bell. Don't miss any of the videos that we bring out every Monday, 6:30 GMT time. My name is John Collett, and why am I qualified to talk about this? Well, in March 2018 I got diagnosed with type 2 diabetes, and I managed to reverse my condition within 6 months. And if I can do it, you can do it too. What is mg/dl and what is mmol/L? Well, mg/dl stands for milligrams per decimal litre, and mmol/L stands for millimoles per litre. Depending on what part of the world you're from will depend on how your glucose meter will read your blood sugar. And you need to think about this a bit like tape measures. When you buy a tape measure, it'll have both feet and inches on it and centimeters and meters. And that is because depending on what part of the world, they will measure in feet and inches, and depending on what part of the world you're from, they'll measure in centimeters and meters. Ultimately, it gets you to the same spot. But what is the difference between a glucose test and an A1c test? Well, a glucose test, which is measured in mmol or mg/dl, measures your blood sugar at that moment in time. Well, an A1c test or HbA1c test will measure your blood sugar over a 3-month period. And this is normally done by your doctor. But how do you manage to get a HbA1c test done without going to the doctor and having a needle stuck in your arm? Well, I've done this conversion chart for you. And on this conversion chart, you can see that what we've got is a column for mg/dl, if that's how your glucose meter works, or mmol/L, if that's how your glucometer works. And as you can see in the first column then, we've got your HbA1c. Now, I don't want you to think that you can do a glucose test. It comes out at, say, 6.4 mmol and think, all right, my A1c is 5.4, because that is not an accurate way to do this. Because A1c tests are done over a 3-month period. So what you need to do to find out what your actual HbA1c is have a number of blood sugar tests done. So let's just say you've done, with your glucometer, you have done 10 different readings. You can then add all those numbers up, divide it by 10, and then use this chart to get a more accurate version of what your HbA1c is. Okay, so don't do it on a daily basis, do it on an average over a period of time, however way you want to do that. So I've also done a spreadsheet, and on this spreadsheet you can record your mmol/L or mg/dl on here, and then you can use the conversion chart to convert that over to your HbA1c. And if you want a copy of this, then please click a link in the description below, and that will bring up this page. Now stick your name and your email address in there, and then I'll send you an email with an attachment with this spreadsheet on. And I hope you find that useful. Now I'm going to stick another video here about how to lower your A1c naturally and quickly, and another video here about different breakfasts involving eggs you can use to reduce your A1C as well, and another button there for you to subscribe. Just remember, you're not a number, you're a rhino. Now charge.